medicine doesn't have all the answers. They don't have all the answers. There are still techniques and practices out there that they don't know of, and by limiting themselves to what they read about in the journals, nobody's willing to take a step to find out if there's a possible treatment that will actually work, that will meet or exceed the expectations to treat some of these other conditions. And if, as long as the sources and everything are fine and the health is fine, I don't see any problem with examining every facet or opportunity to get to that point of treatment. My name is Larry Brothers. I practice optometry in Joplin, Missouri. I'm in Springfield at the Stem Cell Awareness Seminar this afternoon, where we got a chance to hear about some of the other opportunities available for people, and for the students, for the kids, for the families, to have stem cell treatment as a treatment for their kids to change their lifestyle. I've seen 7 or 8 kids in the office or family members in the office that we have done follow-up that have had the stem cell therapy, and we've talked to about another probably 7 or 8 more along the way, just to help them with some of the directions that they needed. So what I see is that the question that a lot of people ask me is why don't we do this in the United States? And personally, what I think it is that and I have had conversations with some of the networks when they would ask me, why don't we do this here? And I told them that my biggest feeling of it is that the politicians who insist on grouping the fetal and embryonic cells that would be tied in with cloning and abortion into the umbilical/adult cells. And if they would separate them, they know that there are 80-some conditions at that time, last I checked, 80-some conditions that are treatable, acceptable by the FDA with the umbilical cells, with success, and there are 0 successes with the fetal and embryonic. If they would take a step back and look towards the one and focus on the one that they know does work and set it apart, then I think that you're more likely to see that sooner. But there's so much controversy on just the words, the 2 words stem cells, that everybody has negative connotations about it. 2 of the 8 were SOD and the others were ONH. But some of the children are more profound in the depth of their conditions, and you may not have the verbal communication. You may not have the child that sits down there and carries on a conversation, but when you still talk to the parents of those children, they still are touched by the same things that they see the development changes in their child, even with the SOD, even if it's something that is more profound. The child may not get up and run across the room, but there may be looks or responses that are, to me, would make it worth it as a parent. I have one. There's one that we had questions about whether it was not. And actually, he's one that has done the best. He's one that has done the best of all of them that we've seen. We thought that he might have been misdiagnosed, but he was. The others felt that the diagnosis was correct, and they did the procedure on him, and he is actually the one that has improved more than anybody else. That he is the one that is running through the house, and he sees last time we saw him, he was about 2060 to 2080. He is doing just fabulous with what he's got. With some of the individual kids, we have seen the first child that we saw was seeing about 24,000 one day, or one month post-op. They were down, which is the big E at 2 feet. The next visit 1 month later, they could see down to the 3,000 foot letter, and so it was a 25% improvement in 1 month. That same child is now down to about a 2,600 letter. That is the best one that I've seen is around 2,160, 2,100, somewhere in that range. And these are kids that had various degrees of blindness or partial blindness, light perception. But the biggest thing that we see is their functional vision. They are running in the house without bumping into furniture. They are picking up things that are dropped on the floor. They are seeing the things around their house that everybody else takes for granted. They can see their mother's face. They can see the fireworks. They can see the lights on the Christmas tree. Things that everybody else just overlooks. You don't see perfection when the people that you see have gone through this, but you see significant, dramatic functional improvement in their quality of life. Do they see 20/20? No, but it's just a number. They do things, they can function better now than what they did before the treatment. The way we check the acuity is with the Snellen eye chart. We use a low vision chart which sits in the child lap, but it's basically a large eye chart. When you see the when you measure a large letter on a single page on a chart, they have one chance to get it right or wrong. There is not the next page, just as in the eye chart, is a letter that's much smaller. So it's hard to in the weaker prescriptions. It's hard to get a definitive answer. If the child comes in tired, they may not be able to see the one big letter. They may get it right the next time, but if they miss it the first one, the next page is another 25% or 30% improvement, or a smaller letter, and they may not be able to visually see that. And so the changes are small. That's why the longer term follow-up becomes necessary, because you can't just look at it from day to day. You have to see the trend. You have to look at the trend and follow the history on it. The acuity is not the best test to look at the chart, the eye chart. What we look at is the information on the MRI to make sure the diagnosis is correct. We look at the optic nerve. We take a look at the retina and the optic nerve to make sure that it is truly the optic nerve hypoplasia or the SOD, because that's the ones that we know have been treated successfully. We look at having an MRI done, as well as an ERG, electroretinogram, and or visually evoked potential and or visual evoked response, which are electronic testing to test the function of the optic nerve and the optic pathway to make sure the signals are getting from the eye in front to the vision center in the back of the brain. The placebo effect eventually wears off, if it's a placebo effect, and there may be some of that. I had a comment once that even that a mother, talk about the lack of understanding of what actually goes on using the umbilical cells, that the question to somebody was, if they use the stem cells of an Asian baby, will their child develop Asian characteristics? And it's just the lack of knowledge or lack of understanding of what actually goes on. The stem cells, like every other cell in your body, is going to degenerate over a period of time. And if they come in there, if there is some placebo effect, maybe if it jump starts it, great. But the placebo effect's not going to be something that continues. The two I've had is I've been kicked in the shin and had my eardrums almost shattered from screaming kids. But it is, I've not seen, for the side effects for the kids, I've not seen any problems at all. The kids all experience normal growth patterns that we see with other children their age. The health and everything seems to stay well within the normal limits. I don't see any side effects. It's just, all it does, it looks like a booster shot to help them along their path a little bit quicker. Medicine doesn't know everything. The doctors don't know everything. They know what they've read and they know what they've been trained. And this technology is new enough to probably a majority of them that it is. They don't want to take a step. They don't want to get out of the box. And rather than taking care of the child with the CP in the wheelchair, or the hypoplasia child in a wheelchair, they tend to overlook and look for the easy way out and move on to the next person without devoting time. The quality of life is the big thing. The quality of life. These people may never be able to sit down and read the want ads, but they can do things that everybody else hasn't been enjoying and just overlooks. Be patient. Be patient with everybody around you. It is a new enough procedure that the doctors, the medical community, does not fully embrace it. You will find people that are very negative, very skeptical about it. At best, skeptical. At worst, much worse than that. Families that mean well, but they don't have the same interest as you would as a parent. And so if they don't agree with you, don't take it too personally. Just move on and do what you think you need to be doing. These are truly, I've been doing this for 25 years, and these are truly, these families, the children and their family are truly the most dramatic patients I've ever seen, and I wouldn't trade them for anything. I would encourage everybody to take, if they have an opportunity to follow one of these children, that it is something that will really give them an insight into what they're doing, the true insight into what they're doing.